looking back into the amendments, looking back over the bill, and I would like to ask Senator Howard a question, please.
Senator Howard, may you yield?
Yes. Senator Howard, you had mentioned, and I believe here on the floor, or I'd heard others say that the physician will make a phone call to the partner. Is that correct?
That's part of the recommended CDC protocol at this time.
But we do not have anything in our statutes or in our amendments that require that statutorily to be done. Is that correct?
No, it is not in the statute.
And why have we not put this into the statute?
I worked very hard on this bill to make sure that we weren't telling providers how to provide care. I think there's always a concern of Nebraska becoming a nanny state, and so I wanted to make sure that providers follow the CDC protocol as recommended currently, but I didn't necessarily want to force them to tell them how to provide the care that's necessary and individualized for each of their patients.
Thank you, Senator Howard. That does seem to be an important aspect here, that this expedited partner be spoken with to ensure there are no existing medical conditions, existing prescriptions that could cause complications, that this is not an antibiotic that they have taken repeatedly where its effectiveness may not no longer be the correct and proper treatment. Without this written into legislation, it makes it optional for a physician to see or to prescribe something. So the physician may choose not to. Is that correct, Senator Howard?
Exactly. This is an opportunity to use expedited partner therapy, but not a mandate.
And that does increase my concern when that contact is not made and it is a prescription with multiple side effects, multiple reactions, where there could be multiple partners perhaps, and we have not been thorough in speaking with the partner and treating it as if it were an everyday over-the-counter medication when it is not. And in seeing that there are so many things that we have left unwritten in law, it is a greater concern that your intent here is very good, that we do need to treat people. However, we don't treat people the Nebraska way here without knowing exactly who we're talking with. Is that person who they are said to be? Is this the best possible treatment for this particular individual situation? Looking at a general guideline medically, I think could have impact on the spread of this disease here in Nebraska particularly, that it's taken lightly, that don't worry. There's no phone call with this doctor. All you have to do, walk in and say, I've got
1 minute.
This partner, I've got several partners, and you can get all the scripts you need. That doesn't seem to be the policy, good public policy that Nebraska has followed, that we should address legislatively, specifically, that contacts, phone calls, documented phone calls, affidavits perhaps, to acknowledge that the partner is who is intended to receive this medication, assurance that this partner could possibly be pregnant and you're prescribing something for a pregnant person who has not been to a physician yet. There's just so many unknown things here, and I don't know if more amendments, would you disagree to having an amendment on this, Senator Howard?
I absolutely would. I feel that AM 605 amended the bill in a form that the Health and Human Services Committee worked on diligently. Thank you.
Thanks, Senator Brasch.